So, this again the same thing, 90%, 45% semen sample, spin, and after you spin you take out the test tube, you see that the good spermatozoa are in the bottom of the test tube. Now, this is the procedure for density gradient media. So, semen processing media is taken. So, this you should not take directly from the fridge and add to the sperm. So, you should take out from the fridge and keep at the incubator at 37 degrees Celsius to equilibrate it at the body temperature, and then you add this media to the liquefied semen. Then this is the lower layer which is more dense, the upper layer the less dense, and then the liquefied semen. Centrifuge it for 15 minutes, discard the supranatant and leave the pellet. Then add the sperm washing media to remove the silica particles. Centrifuge it again so that the silica particles get washed off, and then add 0.5 ml of sperm washing media and then keep it at 37 degrees Celsius and then load it in a syringe. Then this is a sample ready for IUI. This is a processed semen. Okay. Usually we do a pre-wash analysis and a post-wash analysis. So, before centrifuging, the semen analysis is called as a pre-wash analysis, and after centrifuging it is called as a post-wash semen analysis. Mostly we get good motility because all the antibodies which were causing the sperm to attach to each other are left in the supranatant. Then this is an ultrasound guided procedure with a partially full bladder. So, this is how we have put the probe here and then put in a cusco speculum and try not to hold the cervix, and take the cannula loaded with an insulin syringe and push in the spermatozoa in the endometrial cavity. So, this is the conical bottom test tube which are used for centrifugation. This is the sperm collection container, this is the pipette, this is the loading cannula. So, we require a cusco speculum, IUI catheter, 1 ml syringe, uterine sound. Suppose if case we are not able to negotiate this cannula, we have to look at the length and direction of the endometrial cervical canal. So, we need a cervical dilator sometimes. Sometimes we need to hold the cervix if the internal os is tight, and we have to use in the light and ultrasound machine with a transvaginal probe to do a ultrasound guided intrauterine insemination with a partially filled bladder.